Welcome back, everybody, to another episode of Gen Ed. This week, we're super excited to be joined by Anastasia Velikovskaya, who is a fellow volunteer at WAVE and has taught one of our courses in the past. So, Anastasia, would you like to introduce yourself?
Yeah, sure. Thank you so much for inviting me on here. So my name is Anastasia. I go to Barnard College of Columbia University, and I'm currently on the pre-med track studying neuroscience and behavior. I am looking to pursue a career in child psychiatry, but I'm not sure yet. But I'm very passionate about abnormal psych.
Yes, so in this podcast, we will be talking about some difficult and sensitive topics that might be a little hard for some listeners to hear. So I'm just giving a quick warning that this might be triggering for some. We will be discussing mental illness and some other mental disorders that go along with this topic of abnormal psych.
So, with that disclaimer out of the way, Anastasia, what do we mean by abnormal psychology and mental disorder?
That's a very interesting question because there is actually no consensus definition of abnormality. With that being said, there are some agreed upon indicators of abnormality. So, for example, some indicators include subjective distress, maladaptiveness, statistical deviancy, violation of standards of society, social discomfort, irrationality and unpredictability, and dangerousness. However, not one element is sufficient in and of itself to define or determine abnormality. And in fact, what is considered to be abnormal actually changes as society changes. And it's very dependent on society as well. Because abnormal behavior involves social judgments that are based on values and expectations of society at large. Similarly, with mental disorder, it can be a little bit subjective when we consider what is a mental disorder and what is not, but there is an agreement among the scientific community about which conditions are disorders and which are not. And generally, the definition for mental disorder is defined as a syndrome that is present in an individual and that involves clinically significant disturbance in behavior, emotion, regulation, or cognitive function. And mental disorders are associated with significant distress or disability in key areas of functioning, such as social, occupational, or any other activities. And it's also important to note that the dysfunctional pattern of behavior that we typically see does not stem from social deviance or conflicts that a person has with society as a whole. So those are the definitions of abnormality and mental disorders.
Yeah, so how would we classify or diagnose these different mental disorders?
Yeah, so in the United States, we currently use a book called the Diagnostic and Statistical Manual of Mental Disorders, or DSM for short, and it's used to diagnose any mental disorder. It's published by the American Psychiatric Association. And we are currently on version 5 of the DSM because it's definitely a work in progress. It has been revised several times, and it does change as society changes. So, as of now, the DSM-5 is the current version that psychiatrists and psychologists use to diagnose a mental disorder.
So, Anastasia, I've heard of the DSM-5 referenced before, and most of the time when I've heard it referenced, it's been in the news with some sort of controversial position or definition. Could you talk about real quick any of the controversies that have been associated with the DSM in the past?
Yeah, for sure. So one controversy that I can just think of off the top of my head is homosexuality was actually in the DSM before. And in 1973, the American Psychiatric Association removed the diagnosis of homosexuality from the second edition of its DSM. And another change that I can think of that was a little controversial actually was an important change that happened from the DSM 4 to the DSM 5. So, with the eating disorder anorexia nervosa, one of the criteria in the DSM 4 was that cessation of menstruation needed to have happened in order for a person to be diagnosed with anorexia nervosa. And right now, in the DSM 5, that is no longer a requirement. So, of course, now prepubescent girls and people who don't have periods can be diagnosed with anorexia nervosa. So, that is a very important change that is reflected in the DSM 5. And Dan, I know that you actually study history, so could you speak a little bit more about how the views of mental illness changed over time?
Yeah, as you've mentioned with the updates to the DSM, our views on mental illness have changed dramatically, especially in the last 100 years or so. For most of human history, views on mental illness have been pretty um, standardized and in a very not good way, in a very unhealthy way. Um, Obviously, history doesn't move linearly, so some societies were more tolerant than others, but for the most part, until about a century ago, mental illness didn't really exist as a concept. People didn't really understand um, how emotions worked and how our brains function. And so most of the time when people exhibited these abnormal behaviors, they were chalked up to evil spirits or possession or some sort of supernatural or evil force. And so people who had mental illness were often treated very poorly. Um, and yeah. Um, and as I mentioned, these views stayed more or less the same for centuries. Where you read ancient sources and they'll mention things about people being possessed by evil spirits, which we tend to interpret as someone having mental illness. And even just a few centuries ago in Europe, it was very common to try to perform exorcisms on people with mental illness, or to just lock them up in asylums and just kind of push them out of sight, out of mind. Luckily, in more recent years, we've become a lot more understanding and try to actually help these people rather than lock them away or condemn them as being, possessed. So obviously that's a very positive change that we've seen over the last few years. Alana, all this talk of how our views have changed over time, um, and and how mental illness has been viewed so negatively for so many years makes me wonder how did these mental illnesses come about in the first place? How did they come about, and then how did they stick around, even though we kind of perceive them as being negative attributes?
Yeah, so kind of a general overview is that mental illnesses were even in like the Neanderthal times. So hundreds of years ago, researchers are actually comparing like the evolution of mental illness by looking at these Neanderthal and then like current human genomes. So they're actually studying these. And for one example, they found that the schizophrenia is actually, they found it in uh, like Western Europe currently, and they're they think it actually helped them with the cold. So they would see these like in the genes of people who are living in these cold temperatures. So they think that the gene that holds like schizophrenia, and it is like polygenic, so there's like different phenotypes which influences more than one gene. That's like different disorders, but with schizophrenia, they think that this gene will actually help them survive in like these colder temperatures, and that's really crazy to think. But anyway, so these, as I said before, the psychiatric disorders all are polygenic, and so this means like it's influenced more than one gene, and this can involve hundreds or thousands of genes and DNA mutations, which I can explain later. But mental illnesses may still be around despite of and because of natural selection. And so researchers are currently looking at the genomes of various people and trying to connect mental illness with different environmental factors and societal conditions. So, Anastasia, do you have anything to like extend off of that?
Yeah, first, I think the question about how and why abnormal psychology exists through an evolutionary perspective it's very fascinating. It perplexes still a lot of researchers, a lot of scientists. And, it sheds light, in the past, few decades. It's interesting to note that a lot of mental disorders can actually be viewed as beneficial to our survival. But, you know, the cost is that they would be detrimental to our mental health, which natural selection may not even consider or care for so long as we survive, because humans are wired for survival. And, when we're thinking about mental disorders like PTSD, we all have a fight or flight alarm response in our brain. And it was originally designed for primitive survival. So, the part of our brain called the amygdala, which processes fear, it gets triggered by just the merest hint of a possible danger. And its job is to protect you, not to keep you comfortable. So, it would rather set off 1,000 false alarms and create 1,000 wishes of fear and anxiety when there is no problem at all than miss one that is real. So, people who have PTSD, for example, get very anxious and fearful with neutral stimuli like loud noises that remind them of their traumatic experience. And even though this startle response is very distressing, looking at it from an evolutionary perspective, it's actually very beneficial for survival. Because the amygdala gets triggered and prepares for this fight or flight response, even when there is no real danger. And, with trauma, frequently dissociative identity disorder, formerly known as multiple personality disorder, can develop. And that is a disorder where individuals develop multiple identities and amnesia as a way to cope with the trauma they have experienced in childhood. So, one common symptom of DID is depersonalization, which is the sensation where a person feels as if they are outside of their body, floating above, watching themselves. And this also frequently happens during a traumatic experience, and a lot of people, experience this. And this can also be viewed as, very beneficial, because when a person literally can't handle the trauma and pain that they are going through, they completely dissociate. And, going on with anxiety disorders as well, like specific phobias. A lot of people have a phobia of spiders or snakes or heights or flying. And as a result, they avoid these objects or situations. So, these phobias, even though they're very distressful, they can actually keep us safer because of this avoidance. And it's interesting to note that people who have a specific phobia, they usually aren't afraid of things that are completely harmless, like flowers or chocolate.
Yeah, that's so interesting. And just going off of the phobia part, I actually read how trauma can actually genetically be passed on through your genes. So, in one case, I read the novel It Didn't Start With You by Mark Wolin, and he's a psychologist. And so, in one case, he had one of his one of his patients, she had panic attacks often, and when these happened, she felt like her heart rate was like kind of being slowed down, and she felt very isolated and actually freezing cold. That's how she described it as. And once they went back through their like family history, she actually found that one of her family members actually passed away like during the Titanic, and her mom was just like a baby on board and she ended up living. So it's crazy how you can think like how our trauma responses can be passed down genetically. And this is also seen after the 9/11 attacks on the Twin Towers. There have been pregnant women traumatized by those attacks, and they have passed on a stress to like their newborn babies. So these mothers who experience post-traumatic stress disorder, PTSD, during pregnancy, they had an increased level of cortisol, which is the stress hormone. And so with this, the mother, it passes on to the baby like through the placenta barrier. And so like these children, they had a much higher level of cortisol because of the stress that the moms had with these 9/11 attacks. And so this cortisol is a stress hormone, so it increases your blood pressure, increases like your blood glucose. And so, like, this increases the chance that the child will later on develop stress disorders. And they're still keeping track, like, people are still researching this. So, it is possible that the stress certain people experience could actually be passed down genetically. So, it's not just one factor that might put someone at an increase of developing a mental disorder. There is a common myth that hormone imbalances actually cause different mental disorders. And this isn't necessarily true. It was pushed in the 1900s. Psychiatrists, I mean, they actually promoted using like different hormonal therapy to treat different mental disorders that are still used today, like using serotonin, dopamine, epinephrine. And the pharmaceutical companies were actually the ones to mislead the public with promoting this chemical imbalance to sell like antidepressants like SSRIs, and these are known as selective serotonin reuptake inhibitors. And so this hypothesis isn't really true. It's not supported by many today. In the early 2000s, this imbalance theory was like tackled again and found that the theory isn't present. Most psychiatric disorders, they result from a combination, a complex interaction of like physical, psychological, social factors, and the treatment might be directed like towards these. So they found that like the depletion of serotonin may aggravate depression, but it won't necessarily cause it. And so these pharmaceutical companies were so pushing, like selling drugs more, that like this myth of a hormone imbalance causes mental illness when that isn't true. Lots of it has to play in like how we develop like depression. It includes like biochemistry and genetics, personality traits. So it has a lot. It's not one thing, and one hormone can't really cause. It has a lot to do with, like, outside factors as well. So, now that I'm talking so much,
That's really interesting.
so yeah.
I wanted to add what you said about medication and pharmaceuticals. I think that's so fascinating. I also taking a lot of mental disorders are very biological in nature, like you said. I mean, there are a lot of factors that, are at interplay. And taking medication actually is very hard for certain individuals, not only because of the side effects that these medications have, or that these medications don't help people at all, just because, with antidepressants, for example, not everyone who takes antidepressants get helped. And I actually read a memoir, which I highly recommend for everyone. It's called An Unquiet Mind by Kay Jamison. And she's a clinical psychologist, and she was explaining how she was, battling with bipolar disorder. But interestingly, what she said was she didn't, frequently she stopped taking medication. And it wasn't only because of the side effects that this medication, gave her, but also because she felt the most productive and creative than she has ever been during her manias. Which is so interesting. And this kind of ties back to the conversation on evolution, because, even Einstein had bipolar disorder. And we usually don't think about mental disorders in a beneficial or, in a positive light. But, with bipolar disorder, for example, manias lead to a lot of creativity and productivity and innovation and research. And that is a very big reason for why a lot of people stop taking medication, because they miss their manias.
So we've been talking for a little while now on kind of the various factors that combine to affect us mentally, and how, as you guys have been talking about, how many of these conditions have beneficial aspects to them. And it makes me wonder, kind of as we were talking about, developing phobias based off of, spiders and such, and kind of those benefits like that. Those are clear benefits in a kind of survival scenario, right? But my question is, what happens once we're out of a survival scenario, when we're in a society, when we're surrounded with other people and need to interact with other people? How do these various conditions, Anastasia, interact with the people and the societies around us?
So I think, yeah, I mean, that's very interesting, because when we think about society at large, the media plays a very important role in, teaching society about mental illness. And a lot of times the media actually, perpetuates stigma that everybody then has on mental illness. So, when we're thinking about, let's say, mass shootings, which are unfortunately so frequent in the United States, a lot of times there is this, sensation, and people say mental illness is to blame. The quote, mental illness pulls the trigger, not the gun. And, that is a very controversial, topic every time it's brought up in society. And it's interesting to note that the American Psychiatric Association actually doesn't blame mental illness for mass shootings and for these violent events. And they have done many studies to show that people with mental health issues only commit a minuscule percentage of mass shootings and account for less than 1% of annual gun homicides. And in fact, people with serious mental illnesses are more likely to be the victims of violence. So, the media sometimes does perpetuate the stigma of mental illness, and even in movies as well.
Yeah, I mean, I know that just in my life experience, I've seen a lot of movies or heard of movies or TV shows that definitely paint those with mental illness in a very poor light. A recent example being the movie Split, which, is a horror movie featuring somebody with DID. I find it really interesting that it's not very surprising, right, that the media finds these people with mental illness as an easy scapegoat. It's an easy way to not really have to deal with an issue, because you can just say, oh, the person who did it has suffers from a mental illness, which I do think we're getting a little bit better at handling, fortunately, because it is a very negative and a very problematic way to view people and to view the world. I was also wondering, Anastasia, are there any, when I look at, say, America, we have a lot of mass shootings, and we blame a lot of these mass shootings on mental illness. even though presumably mental illness rates are similar across the world, and yet we have a much higher rate of mass shootings. So I was wondering, Anastasia, how do different cultures deal with mental illness in today's world? Are there societies who maybe perpetuate certain mental illnesses more than others?
Yeah, that is a very important question because culture definitely shapes, the clinical presentation of many of these mental disorders. And there are culture specific disorders as well. Um, and even just thinking about the DSM is only used in the United States. So there is controversy over, how some disorders like PTSD are very westernized and how the criteria and the symptoms aren't, they don't include a lot of cultures. And, with your question on, how culture impacts the manifestation of mental disorders, that's a very important question. And, you know, rates of mental illness definitely vary across countries. And Japan, for example, has the highest rate of eating disorders. And that just goes to show how, culture has a clear impact on society's view of beauty. And, Japan, along with other countries, including America, often idealize this extreme thinness that, girls and women need to strive for. And these cultural pressures that exist all over the world, it can explain the female to male ratio of anorexia nervosa and bulimia nervosa to be 10-1. So, even though males can definitely and do have eating disorders, there is this, it's very much skewed to, girls and women, which goes to show how big of a role culture can definitely play in causing a lot of these mental disorders to, get to exhibit in different people.
I was just going to say, as you said earlier, Anastasia, I mean, as of a couple decades ago, it wasn't in the US, you couldn't even diagnose a man with anorexia. The conditions were such that that just wasn't even possible.
Yes, exactly. Yeah, and that also goes and ties into, how there's a lot of stigma, especially surrounding men with eating disorders because a lot of times men who do have eating disorders feel embarrassed to go get help, to go to a therapist. But, our society, as you said, is changing for the better to try to be very inclusive when we're thinking about mental disorders and not to lump specific groups of people in different categories.
Yeah, for sure. Just going off of that stigma you brought up, um, in our culture, like some people tend to like romanticize different mental illnesses, and I think that's very predominant while on social media. Especially how Dan brought up like the movie Split. We also see that with like the movie and novel 13 Reasons Why. The author who wrote that book didn't intend for this, I guess, idealization of the movie or the show to occur. He didn't want that to happen. And we see, like, especially in the US, higher rates of suicide in teenagers. Like, every 1 in 4 teenagers face mental illness. And I think it's something very important to talk about. And through talking about it, this is how, like, we can eventually break the mental illness stigma. And by educating ourselves and talking more about like what we're doing right now, how to use the appropriate terms and to not offend anyone who actually is facing problems with a mental illness, and just to show compassion with others. I think that's eventually how we can break the stigma. Anastasia, do you have anything to add on to that?
Yeah, I think, what you mentioned, what you and Dan mentioned with the media and how that impacts mental illness, I think that's a very important conversation to have. And, 13 Reasons Why, a very controversial TV show, did result in an increase in suicide, among teenage girls. And the phrase actually, this is actually known as copycat suicide or the Werther effect. And the Werther effect, the phenomena, this term was coined in 1974. And it refers to the phenomena that humans tend to copy behavior, whether it's healthy or destructive. And copycat suicide is most definitely blamed on the media. And, not only with 13 Reasons Why, but also with celebrities. When we hear about a celebrity dying by suicide, it's plastered all over the news. It's on every news channel, all social media accounts, and everybody knows about it. And that can definitely, impact this rise in deaths by suicide. And, in Austria, they actually had a similar problem in the late 1980s, where there was an uptick in dying by suicide in the subway station, and there was a lot of media coverage on that. And what they did in Austria, they decided to stop covering and stop including these stories in the media, or if they did, then don't emphasize them so much. And they found a decrease in suicides once they implemented that. So the way that media portrays mental illness, whether that's in actual news or in TV shows and movies like Split, is very important. And it's definitely something we need to, get better at with a